So a while back, a lady walked into the clinic where I work looking so worried. She said she used protection, but days later, she started itching badly. She felt swollen down there. I was even spotting. Her first thought was, maybe I have infection, but then she ran some tests and the result came out clean. So what was the real issue? She was reacting to something you never would have thought about. Yes, the condom itself. We all know that condom protect us, right? But they also have their side effects. So today, let's talk about the side effects of condom. Hello and welcome to my channel. My name is Sandra. I'm a registered nurse and midwife with a BNSC degree. On this channel, we'll talk about all things health. If these are the type of contents you're interested in, please do not make it your last by clicking on the subscribe button and the bell icon beside it so that when I upload a new video, you'll be the first to get notified and be the first to watch it. Please don't forget to like this video. With that being said, let's dive straight into the video. Most people experience these side effects of condoms and mistake them for an infection or something else. So in this video, I'll be explaining the lesser known side effects of condom, how to know they are affecting you, and what you can do about them. This will help you understand what really happens when you use condoms, beyond just preventing pregnancy and STIs. Condoms are one of the most effective tools for protection. It is the only contraceptive that can protect you from STIs and from unwanted pregnancy. This video is not to scare you from using them, no, but to help you make the right choices when getting your condoms. Let's start with the most common one, which is the latex allergy. Some condoms are made with latex, and for some people, their body sees latex as an enemy. They react to it so badly. It can cause symptoms like redness, swelling, itching, a rash where the condom touched the skin, or even a burning sensation. And in severe cases, there can be difficulty in breathing, running nose, and a drop in blood pressure. So if you experience any of this after intercourse with a condom, you're probably not infected. Your body might just be reacting to the material. And if you know you're allergic to latex, always take time to read through your condoms to be sure that it was not made with latex. Or maybe you don't know you're allergic to it, you use a condom for the first time and you experience these symptoms. Avoid that particular condoms. Go for latex-free condoms. They are sold in the pharmacy. Another side effect of condom is that they can cause vaginal dryness or friction. Some condoms don't come with enough lubrication, and this can cause friction during sexual intercourse, and then you start to feel sore or start to feel uncomfortable afterwards. Sometimes, because of this friction, you can get tear in your vaginal wall, and when this happens, it increases your risk of infection. Now, what should you do when you experience this? You have to avoid that particular condom and go for condoms with lubrication. You can also get a good water-based lubricant to help with vaginal dryness and pain. The third one is vaginal irritation. We have condoms that come with spermicide, a chemical that kills sperm. We also have condoms that contains flavor or scent. This type of condoms can irritate the vaginal wall for some women, and they will start to experience itching, discharge, or a burning sensation after intercourse. Now, what you do is that when you go and buy your condoms, avoid condoms labeled as spermicide coated. Also, avoid flavored or scented condoms. Go for unscented condoms. Another side effect you can experience from using condoms is that it can cause a change in your discharge or pH imbalance. When you use condoms frequently, they can affect the natural pH of your vagina, which can lead to an overgrowth of bad bacteria or yeast, causing recurrent infection or a change in your discharge. I have a video on why your vagina keep coming back on my channel. I'll be leaving the link here. I'll also be dropping it in the description box. So do all to check that video out so you know why your vagina infections keep coming back. Now, what you do is when you notice recurrent infections after using condoms, always make sure you go for pH-friendly condoms or the ones that are made from natural materials, and also don't doubt, as that can worsen imbalance. Then there's also the psychological side effect. It's not always physical. Some people experience reduced pleasure or discomfort when they use condoms, and this can lead to tension and anxiety about intercourse. This can also affect your emotional and mental health around intimacy. For this set of women, whenever they are to have sexual intercourse with a condom, they'd rather not want to because they know they're not going to enjoy it, or it's going to cause some sort of discomfort to them. So if you experience this as a lady, the best thing for you to do is to talk to your partner. Try different types of condoms. There are condoms that feels like skin. You can try them out and focus on building comfort and trust. Let's not forget about the guys. They also experience some side effects. Some men complain of reduced sensitivity, delay in ejaculation, and even allergies. So if your partner keeps experiencing this, explore different brands or textures of condoms. Condoms are still safe and highly recommended. The most important thing is to know what works best for you and your partner, of course. If you notice any of these symptoms we talked about today after using a condom, don't panic. Just switch things up, and if they are not going away, then it's time to see a doctor. If this video helped you understand your body a little better, please give it a thumbs up and share it to someone who needs to hear it. Don't forget to subscribe, and always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching this video, and see you in my next video. Bye.